As students start to head back to school, we're taking a look at how to best stay prepared for cold and flu season. Here with what you need to know now is Dr. Gary Kaplan, founder of Kaplan Center for Integrative Medicine in McLean. Good morning.
Good morning, Marissa. It's delighted to see you again.
Good to see you as well. Doctor, let's just begin with the importance of getting vaccinated.
Oh, no question. Listen, vaccines, think of vaccines kind of as seatbelts. Vaccines aren't necessarily about completely preventing the disease, though we'd like to. But more importantly, what it does is it keeps you out of the emergency room, keeps you out of the hospital, and can keep you alive. So vaccines are crucial in terms of prevention and mitigating the severity of the illness.
We know that the students, a lot of them have vaccination requirements for many school systems. When it comes to vaccines in general, though, who should prioritize getting them?
Oh, hands down. Anybody over age 65 absolutely needs to be getting these vaccines. Women who are pregnant, protecting both themselves and their children. We want to protect everybody who's got any chronic diseases, diabetes, heart disease, cancers, immunocompromised individuals. Extremely important that we get these people vaccinated. Healthcare workers, look, the reality of the matter is we're taking care of vulnerable people. And so we need to make sure that we're protecting ourselves in process of protecting them. So we want to make sure healthcare workers and caregivers who are taking care of the vulnerable all get the vaccine. Young children also, because the reality of the matter is small children can actually get very sick from these bugs, and they spread it like wildfire in school environments.
Based on your knowledge and expertise, what are you expecting this respiratory virus season that's coming up?
Well, yeah, so we're going to be seeing lots of flu and lots of COVID. If we compare it to our last season, we saw about 30 million cases of flu last season, resulting in about 400,000 hospitalizations, 24,000 deaths. These are preventable if we get these vaccines. COVID, still hundreds of thousands of infections. There's not as seasonal as flu is, so it's kind of year round. But once we get indoors and we're more together, the bottom line is going to be we're going to see considerably more cases, so we're expecting a significant surge. That resulted so far in the last year in about 290 to 450,000 hospitalizations and deaths of 34,000 to 53,000. Below the pandemic area, but still a truly tragic number. The other thing you need to keep about is with COVID is post-COVID syndrome. This is where you remain sick for months and possibly years after you get the disease. Getting the vaccine will actually reduce your risk of getting post-COVID disease by about a third.
Wow. I did not know that tie existed there. Finally here, along with the vaccinations, what can we all do to just build up our immune systems as we move forward into fall?
The basics, back to sleep. Make sure you're getting 7 to 9 hours of sleep a night. That's when your immune system's doing its most work. Diet. Eating high sugar carbs basically kiboshes your immune system. And so we want to make sure we're eating a good, healthy diet, lots of fruits, vegetables, and proteins. Exercise ramps up the immune system, so we want to make sure we're getting proper exercise. Hand hygiene, washing your hands. Twinkle, twinkle, little star, especially before you eat. Sing that to yourself, and that will give you the amount of time you need to be washing your hands for. Managing stress. Stress kiboshes the immune system. So we want to make sure that we're managing our stress issues. And if you're sick, stay home, because that gives your immune system a chance to recover, but it also prevents your spreading the disease to others.
Yeah, you mentioned stress. I feel like a lot of people go, well, that's an oxymoron with back to school season, but you have to do your best and do the things that you know you should to stay healthy. Dr. Kaplan, thank you so much for joining us. We appreciate your advice.